I had been kind of feeling this thing popping out of my neck, and so I sent a picture to a friend who was an oncologist here in Wichita, and I was like, hey, I have this coming out of my neck too, and he was like, okay, that's not good.
Doctors told Zack Schroeder he would need treatment at a cancer center more than 500 miles away from his home in Independence, Kansas.
My family spent over $8,500 on just travel and lodging. None of that covered by insurance.
After radiation, surgery, immunotherapy, and almost 5 years of clear scans, Zack will soon be able to say he's in remission. But now, he's on a mission.
Between heart disease and cancer, those are the two leading causes of death. And to tell people that they have to travel this distance to get treatment for these things, I think is tremendously wrong. If you look at the mortality rates for urban and rural, they're both decreasing just because science, surgery, and everything is getting better. However, there's a gap between urban and rural falls behind. And there's always been a gap since 1999. But the problem is the gap is widening.
Zack co-founded the Rural Cancer Institute, dedicated to closing that gap. When he's not meeting with lawmakers, he's trying to normalize the idea of keeping oncology care closer to home.
A lot of people are just naive to it, even people in healthcare. I tell oh, I want to do rural oncology, like, is that a thing,
He co-authored a recently published article in the New England Journal of Medicine Catalyst, proposing a new model of decentralized cancer care.
We get a local patient with a local provider, a general oncologist, and then we leverage telehealth with specialists in urban areas, or maybe they go see the specialist 1 time or 2 times in the urban area, and then they get to do the majority of their treatment close to home.
Changing the status quo is always a challenge, but Zack's experience and optimism keep him going.
When I tell somebody, hey, I want to be a rural oncologist, and then they say, no, you can't do that. It's good that I'm probably too strong in my will sometime, in my ways, that I'm oh, yes, I can.